Let's dive into the devastation of the Black Death, one of the most catastrophic pandemics in history, which tore through 14th century Europe and claimed the lives of nearly 60% of its population. Imagine, that's about 450 million people today. We'll take you on a journey back in time, exploring the steps people might have taken to survive this deadly disease. But first, hit that subscribe button and let's set the stage for survival. Avoiding large gatherings would have been one of the best ways to sidestep the spread of the Black Plague, a lesson that's still relevant today. Imagine the crowded marketplaces of medieval towns, places where pneumonic plague spread rapidly through air droplets, allowing infected people to transmit the disease with every cough and sneeze. In the case of the bubonic plague, the risk came from flea bites carried by infected rodents. Fleas, already thriving on these rodents, would hop from host to host, spreading sickness. Survival could have hinged on physical distance, even though medieval folks didn't understand social distancing as we do. Remaining at least 2 meters away from a flea-infested rodent or infected person could have been a game changer, though few realized it at the time. Italy, with its bustling ports, was hit hard due to trade bringing in goods and diseases from across the sea. Milan's approach was one of brutal isolation. When the Black Death arrived, Milan's leadership locked down infected homes, sealing the sick inside to contain the spread. This draconian measure meant sacrificing even healthy family members to quarantine. But Milan saw one of the lowest mortality rates in Italy because of it. Life was grim in plague-stricken cities like Florence, where the dead were buried in mass graves layered with earth, creating a lasagna of human remains, as one observer of the time put it. The deceased were often abandoned in the streets, waiting to be collected by workers who themselves were exposed to infection. These workers, part of the infamous group known as the bikini, no relation to swimwear, were tasked with corpse disposal, often at the cost of their own health and safety. And in times of desperation, strange cures emerged. Pope Clement VI famously sat in a ring of fire, yes, an actual circle of flames, to keep the rats and fleas away. While this may seem extreme, it likely did help him avoid infection, as few creatures dared cross the fire's threshold. In the 1300s, contagion wasn't understood as we know it, so doctors improvised with hauntingly memorable plague uniforms. These plague doctors donned long coats, wide-brimmed hats, and iconic bird-like masks stuffed with aromatic herbs. The logic was simple but flawed. If the plague traveled by bad air, miasma, then pleasant smells would shield the wearer. These eerie get-ups may have helped limit flea bites, but the underlying belief in miasma was a tragic misinterpretation of the disease's spread. Another misguided remedy emerged in the form of the flagellants, groups of religious zealots who whipped themselves in the belief that God was punishing Europe with plague due to sin. These processions of self-inflicted suffering spread the disease further, as they roamed from town to town seeking atonement. Eventually, some European cities tried to quarantine infected areas by stationing guards and limiting ship access. Ships from the east were among the first to carry the plague into Europe, so port cities implemented measures to hold ships at bay for a period. Venice established a waiting period, which they called quaranta, 40 days, to reduce the spread of contagion. This was the origin of the term quarantine, a concept that has become a cornerstone in managing pandemics to this day. Several cities enforced martial law in an attempt to save their populations, shutting down markets, barring public gatherings, and restricting funeral rites. The North Italian city of Pistoia, for instance, lost nearly 70% of its population, despite its strict regulations. Survival in such times seemed almost arbitrary. While some succumbed, others managed to endure due to factors we're only now beginning to understand. Interestingly, genetic factors may have influenced survival. Certain individuals had immune responses that allowed them to recover or at least survive longer. Research shows that some people's genetic makeup made them less susceptible to the bacterium Yersinia pestis, the plague's causal agent. Populations like the Roma were particularly resilient, though not entirely immune. Their genes triggered responses that allowed them to better withstand the deadly effects of the bacteria. Among other prevention techniques, medieval people relied heavily on good air versus bad air. yet their understanding was limited. But not everyone tried to survive through avoidance or medical intervention. Some chose to live life to the fullest, knowing that death might come at any moment. According to Italian author Giovanni Boccaccio, some Florentines indulged in revelries, feasting, drinking, and embracing life's pleasures, believing that joy itself might stave off the plague. Ironically, these individuals often met the same fate as those who took precautions, but at least they lived their final days on their own terms. So, would you have survived the Black Death? Would you have holed up in isolation, embraced flagellation, or thrown caution to the wind and danced in the streets? Let us know in the comments below, and while you're here, check out some of our other videos on the mysteries and survival tactics of history's deadliest events.